Hi, you're listening to the Baby Manual podcast, the podcast that helps you feel confident as a new parent. I'm your host, a pediatrician and mom, and the author of the Baby Manual, Dr. Carole Keim. Hello, my friends, and welcome back to this week's episode of the Baby Manual podcast. This is episode 12, all about illnesses and red flags. So a red flag is a sign that something might be wrong with your baby. It doesn't necessarily mean that something is wrong, but a lot of these red flags that we're going to talk about are things that you would need to bring to your doctor's attention right away. Some of these are urgent, meaning they should be seen by your doctor within the next week or two, if possible, whenever their next available appointment is. And then some of these are emergencies, meaning that they need to be seen right away, that same day. For those emergencies, you would want to take them to the emergency room or call emergency services. If you're traveling, keep in mind that outside of the US, it's not 911 to call emergencies. They have different numbers in different countries. So I recommend looking that up before you go. And remember, it's always okay to call your doctor or the emergency services if you're concerned about something. So the first thing is abnormal temperatures. So fever or low temperatures are both red flags. Ideally, you should be using a rectal thermometer. Those are the very most accurate in babies. But if you are uncomfortable with using a rectal thermometer, you can also get a temporal artery thermometer. The temporal artery ones scan across the forehead all the way into the hairline. You need to sweep the thermometer all the way across like that. And those are different than the ones that you just point at the forehead and squeeze. So the ones that you point and squeeze, those are infrared thermometers, and those are giving you a skin temperature or surface temperature. And that's different than a core temperature. A core temperature is the most accurate, and that's what you get with the rectal thermometer or with the temporal artery. Underarm temperatures or axillary temperatures are also inaccurate because they're giving you skin temps. And you can start using thermometers in your child's mouth when they're about 5 years old and they're able to sit there with a thermometer in their mouth without biting it. But up until age 5, it's generally not recommended because sometimes you can actually injure your baby by sticking a thermometer in their mouth. So reasons to check a temperature, you don't have to check routinely, but if your baby's acting strange, if they're more fussy than usual, they're more tired than usual, they're not wanting to eat, or if they feel really warm to the touch or cold to the touch, those would be reasons to check baby's temperature. Anything over 100.4 degrees Fahrenheit or 38 Celsius is considered a fever. And a fever in a baby who is less than 6 months old is considered a medical emergency. So babies less than 6 months, their immune system's not fully developed yet. And if they get a fever, it usually means that they're pretty sick. Sometimes they actually get hypothermia instead of getting a fever. So anything less than 96 degrees, which is 35.5 degrees Celsius, is considered a low temperature or hypothermia. And that's just as dangerous as a fever. Babies who are over 6 months old, it's still an urgency if they have a fever, but it's not an emergency. So for babies 6 months and older, you should call your doctor if they have a fever. Apnea and cyanosis is an emergency. So apnea is when your baby stops breathing. Now, newborn babies will have what's called episodic or periodic breathing, where they'll sometimes breathe fast for a little bit, slow for a little bit, and maybe even stop for a few seconds in between breaths. But anything more than 10 to 15 seconds is considered apnea, and you would need to call your doctor for that. If your baby is turning blue at all, that's cyanosis. And you usually will see that first in their lips and the tip of their nose, sometimes on their fingertips and toes. If you're noticing cyanosis, that's an emergency and you need to call emergency services or take them to the ER right away. Aspiration and choking is also an emergency. So if your baby is coughing, gagging, arching their back, vomiting, or turning blue, that is time to call the emergency services. It's normal for babies to gag when they're first learning how to eat. So if your baby is 6 months and up and they're trying new foods and you just see the food kind of reappear in their mouth again and then they swallow it, that is okay. That is normal. But gagging on milk or coughing, sputtering, that sort of thing while they're drinking milk is not normal. So that is something you would need to call your doctor about. Blood in the diaper is an urgent thing, but actually not an emergency. So if your baby has blood mixed in with their poop, it's probably a sign of a food allergy. Typically, babies don't lose a whole lot of blood that way. It often looks worse than it is. So that's something you should call your doctor about if you see blood in the diaper and ask about. Now, keep in mind that baby girls around day 3 to 5 might get a small period. That's called pseudomenses or false period. And that's a normal thing, but that's only normal around day 3 to 5, sometimes up to a week after being born. But anything after that is definitely not normal. And in baby boys, they should not be having blood in the diaper. A bulging fontanel is an emergency. Now, the fontanel is the soft spot on your baby's head. There's one in the front that typically closes around a year of life. And then there's actually a small one in the back. It sometimes closes when they're being born, sometimes within the first few weeks or months of life. But any time that that soft spot is raised up, that's a sign that there's too much pressure around your baby's brain. And that could either be from bleeding or from infection or from swelling. So those are reasons to go to the emergency room. Your baby's fontanelle is sort of like a pressure valve for the liquid around their brain. When that pressure goes higher, it can raise up, and it can raise actually quite a bit, but before being severely dangerous, but sometimes even just a little bit of a raise is a red flag. So call your doctor if that's happening. Now, if it's only raising when they're crying or straining to poop or things like that, then it could potentially be normal too, but always worth checking, especially if your baby's showing any other signs of anything like illness or if it's bulging while they're calm. A cough in a baby less than 6 months old is an emergency, and less than 12 months old is urgent. I always tell new parents hiccups are normal, sneezing is normal, but coughing is not. When they're just clearing their throat from a little bit of milk in there, that's okay. That doesn't count. But if it's a real cough, like just when they're laying there, in between feeds, I get pretty concerned about that. Babies who are less than 6 months old, they don't have very strong muscles to cough. And so sometimes they'll cough a couple of times and then their muscles tire out and then they just stop breathing. That's apnea again, and they're at risk of that when they're less than 6 months old. Over 6 months, they're a little bit stronger, but still keep a close eye on them. Over-the-counter cough medicines are not considered safe or effective in children who are less than 6 years of age. So the ones that are safe are things like antihistamines, and those just don't actually work for cough unless they have allergies. And typically babies less than a year do not have those kind of allergies like bigger kids have, like the kinds that cause cough. The other type of cough medicines, the ones that are cough suppressants like dextromethorphan, those are actually really dangerous in young babies because what they do is they suppress your desire to breathe as deeply. And babies already have pretty weak breathing muscles, so they can make babies stop breathing. So don't give any cough medicines to your children less than 6 years of age. For babies who are a year and older, it is okay to give them honey for cough. That's actually the only thing that is safe and effective in children between the ages of 1 and 6. Less than a year of age, they cannot have honey because honey can carry a spore for botulism. And botulism is something that attacks your muscles and makes them super weak, and it can get to the diaphragm and make them stop breathing. So that's a super dangerous thing. So babies who are less than a year, after you've seen your doctor and been cleared, it is okay to give them some agave syrup that is safe and it works a little bit, but you definitely need to call your doctor if your baby is coughing and if they're less than a year old. And if they're less than 6 months old, like I said, bring them into the emergency room. If your baby has been exposed to COVID or flu or RSV or really any cold virus, you want to check with your doctor about that. If they're not having symptoms yet, but they've just been exposed, that's an urgency. Everyone in the house who is sick should be, really everyone in the whole house should be washing their hands often. Every time you eat, before and after eating, after using the bathroom, and then whenever you come inside from being away. Those are all times to wash your hands with soap and water, and that can really help decrease the transmission of germs within the house. A lot of viruses at home will spread through the bathroom towel. So if somebody is sick, they should have their own towel in the bathroom. And that's because, if you think about like if you're sick and coughing or whatever, you've got germs in your mouth, say you brush your teeth and then you dry your mouth off on that towel, you've got germs on that towel now. And the next person who washes their hands, they go to dry their hands on that towel, they've just picked up all the germs. So try to have different towels for people in the house washing their hands if anybody is sick at home. Also, make sure you're keeping the toothbrushes in separate containers. You don't want like a single cup with all the toothbrushes in it in the house. That's another way that infection can spread from one person to the next. And then also sharing food, sharing drinks. blowing on your baby's food to cool it down while they're sick, testing it with your lips to see if it's cool enough for them to eat while you're sick. These are all ways that babies can get sick from other family members. If you're using a bulb sucker to get the boogies out of one of your children's nose, do not use that in your baby because you can spread the disease to them that way as well. If you're breastfeeding and you're sick, you actually want to keep breastfeeding. I hear a lot of moms that tell me, I'm sick. I don't want to get my baby sick. But the thing is, when you're sick, you're actively producing antibodies. You as an adult have a functional immune system that is, working at full capacity, producing antibodies. And some of those get passed through the breast milk. And those antibodies are specific to the thing that you have. So it's like a passive vaccine almost for your baby. You're giving them passive immunity by breastfeeding them. Just make sure you're wearing a mask so that you don't cough or sneeze directly onto your baby, and wash your hands before holding your baby if you're sick. Also, if you're breastfeeding, you can take extra vitamins to help pass through your breast milk to the baby. So you can take vitamin C, 1,000 to 2,000 milligrams per day. Don't do more than that because it can start to cause kidney stones, actually. So you want to do 1,000 to 2,000 milligrams of vitamin C. Vitamin D, you can go a lot higher with. 6,400 units of vitamin D is enough to put 400 units into your baby, which is their basic level for the day that they need. So you can take 6,400 units of vitamin D. You can take echinacea. That one doesn't have any dosing recommendations. And zinc. Zinc is 30 milligrams for adults. Zinc is antiviral and it kills viruses on contact. So that's another great thing to give to your baby passively through the breast milk. If your baby gets any cough or any fever or any other signs of illness, you need to go to the emergency room if they're less than 6 months old, or call your doctor if they're over 6 months. But the exposure alone is just an urgency and a cause to be extra cautious and watch your baby a little more closely. Diarrhea and vomiting are things that can cause dehydration in babies pretty quickly. So if your baby has 2 to 4 episodes in the same day of diarrhea or vomiting, then you would probably want to go to the ER if they're less than 6 months old, and call your doctor right away if they're more than 6 months old. If it's more than 4 times in a row, you should just go straight to the emergency room. Or if they have any signs of dehydration, so things like dry, cracked lips, a dry, sticky tongue, if their soft spot is sinking in, that's from dehydration. Or if they're irritable, like you just can't get them to be comfortable. Or if they're lethargic, like it's harder to wake them up than normal. Those are all reasons to think that your baby might be overly dehydrated and you need to go to the emergency room for that. And it's super easy to fix in babies. You would just give them IV fluids and most of them bounce right back. It's really great. It is okay to rehydrate babies by mouth if they're over 6 months old and they're already taking foods. So you can give them either water or an electrolyte solution. You can Google oral rehydration solution to get a recipe. It's basically water with sugar and salt. You can make it at home, or you can use something like Pedialyte or whatever over-the-counter rehydration solutions you have. And those are okay just to replace the losses. This is not, you're not trying to overly hydrate them with these rehydration solutions. You just want to give them about as much as they threw up or pooped out. Usually it's like an ounce or 2 at a time, maybe sometimes less. Check with your doctor about how much they can have. And then remember, they're on a liquid diet for most of their calories, their fat, their nutrition. So giving them this oral rehydration solution, it's just water and electrolytes. It doesn't really have any calories, or at least not enough useful calories for them to grow. And it doesn't have fat or protein. So they can actually get depleted in those and can start to lose weight if you give them too much of it. So it's just really a little bit to replace those losses. Babies who are less than 6 months old with vomiting and diarrhea, you want to just keep feeding them breast milk or formula and call your doctor right away. All right, for head injuries, I feel like most babies fall at some point. And almost everyone I know, their baby has had a fall. My baby had a fall. She crawled off the edge of the bed and my husband and I were just sitting there watching her, and we both kind of looked at each other thinking the other one was going to get her, and then she just crawled right off the edge. Thankfully, she fell into a laundry basket full of laundry. We were really lucky, but a lot of babies will fall off something at some point. And so you need to call your doctor to make sure your baby does not have a concussion if that happens. Babies don't know how to catch themselves with their hands like adults do. So when they fall, their heads are really heavy and they typically fall head first right onto their head. It takes a fall of about twice your height to cause a serious head injury. And by serious, I mean something that would need intervention, like a skull fracture, like your skull gets broken or bleeding within the brain, or even just a severe concussion. So babies, you remember, are only like a foot and a half, 2 feet long. And so anything waist high or higher can cause a very serious head injury. And I've even seen it in babies that have rolled off of a couch onto the floor if it's a hard floor. So signs of concussion to watch out for: if they lose consciousness at all, at any point right away or later, that's an emergency. You need to take them immediately to the ER. If they vomit 2 or more times after a head injury, if they have a change in personality, like they're crying a lot, especially if there's a high-pitched cry, or if they're really irritable, they're acting differently than they normally do, like their personality has changed, or if they're just having trouble eating, sleeping, those kind of things. Those are all red flags. Uneven pupils is something that mostly happens in older kids once that fontanelle is closed after a year of life, but that's definitely a big red flag if pupils are unequal. If the fontanelle is raised in the younger babies less than a year, that's a sign that there could be bleeding in there. If they have a seizure, of course, you're going to call the emergency services, but that can be a sign of a severe head injury. Or if part of their body is weak. If you think about adults who have a stroke, it's sort of a similar presentation to that, where they're moving one side of their body more than the other, one side of their face more than the other, that sort of thing. Also, after your baby falls, make sure you feel their head and check for something that's called crepitus. And crepitus is this sort of crunchy sensation, kind of like when you have Rice Krispies in milk and it makes that crackly sound. It's like it's like what that would feel like under your fingers. It's sort of hard to explain, but you would definitely know if you felt it. It's very weird and crunchy feeling. And that is a sign that there is a skull fracture. And then if the fontanelle is bulging, that's a sign that there could be bleeding around the brain. And so those are emergencies. You want to call 911 or whatever the emergency service number is, or take them directly to the emergency room. If your baby falls and they just have a big raised lump on their head, especially if it's on the forehead, that's actually a good sign. So typically when they have bruising like that outside the skull and it forms kind of a goose egg on their head, that means that the bleeding at least is going outside of the skull and not inside. So that's something to keep an eye on, but definitely call your doctor, let them know about it, see if they want to bring the baby in to get checked out. A lot of times as that lump reabsorbs, it can kind of track downwards and form bruising under their eyes. So they can get kind of the raccoon eyes or black eye from it. And that's just the bleeding that had happened under their skin, just moving with gravity. So that's a normal thing. A lot of times those look a lot worse than they are and look worse before they start to look better. Yeah, definitely call your doctor after head injuries just to make sure everything is all clear. Jaundice is an urgency unless your baby is starting to get tired or having a hard time waking up to eat, and then it's an emergency. So jaundice is a yellow color of the skin and eyes, and a lot of babies will have jaundice at some point. It's usually in the first 2 weeks of life, almost always within the first 2 weeks of life. And that has a little bit to do with their sort of functional dehydration when they're first born and drinking that really concentrated colostrum, and they're not pooping as much. They're kind of reabsorbing the bilirubin that's in their stool, and that can make it go higher. So, first steps in management, feed them more, feed them as much as you can. And then sunlight is another thing that can help. Passive sunlight, so like through a window in a patch of sunlight indoors, will break down the bilirubin in their skin and form into a type of bilirubin that is able to pass into the urine. So it becomes water soluble, and then they can pee it out. So it leaves their body a lot faster that way, rather than just waiting for them to have to poop it out. If your baby is starting to get tired from the jaundice, that's usually a pretty big red flag, actually. That's a sign that the levels are high enough that it's getting close to getting into their brain. The worst outcome with jaundice, if the level gets too high, is that the bilirubin actually passes into the brain, sticks there, and is permanent and can cause things like brain damage and epilepsy and stuff later in life. So we always try to treat jaundice before it gets that high, and we usually catch it well before that level. So if your baby's looking jaundice and you're concerned, definitely call your doctor. Most babies will be seen a couple of days after leaving the hospital and then about a week after that. So that's some time for your doctor to check. But if your baby is jaundiced in between visits, definitely call. They can do a quick blood test or even sometimes a skin test with a bright light to check their level. A seizure is an emergency. In babies who are less than 6 months old, if they have a seizure, that is usually a true seizure and not a febrile seizure. A febrile seizure is a seizure with a fever. So from 6 months to 6 years of age, babies can get febrile seizures. And those are fine. Those are benign. They're really scary to see because their whole body's shaking. But if they have a fever with it, it's actually a reassuring sign and it's not a risk factor for epilepsy. But babies less than 6 months old, or anyone who has a seizure without a fever, without any other signs of illness, that could be a sign that they may have some epilepsy or some sort of underlying disorder in their brain. Sometimes it's a structural problem. So that's a reason to go to the emergency room and get them checked out. They should be scanned either with a CT or MRI or both, and an EEG, which is an electroencephalogram where they put little wires onto your baby's head. They stick them on with stickers and check your baby's brain waves to see if they're having seizures. So a seizure in a baby can sometimes look a little different than in older children and adults. Sometimes it is the whole body making repetitive jerking movements, but sometimes it's only part of the body, like an arm or a leg or, 2 arms and legs. Sometimes it looks like sucking when there's nothing in their mouth. You'll just see them kind of sucking the air. Sometimes it's fast blinking, and sometimes the eyes will be deviated off to one side. After a seizure, babies will often have what's called a post-ictal state where they're confused, they're cranky, they just seem really out of it, typically 20 to 30 minutes after the seizure episode. So if your baby has had a seizure, call emergency services, bring them to the emergency room and get them checked out right away. They'll probably have to be admitted to the hospital for a workup for that. Also, during the seizure, things that you can do. So move anything that might be in baby's mouth. They can sometimes clamp down, bite off pieces of things that can be dangerous. Make sure that they're not on any surface that they could potentially fall off of. And if you're able to take a video of the seizure episode, that can be really helpful to the doctors later to see that. Also, check the time that it starts and the time that it stops, because it can feel like forever when it's going on, and it may be 30 seconds or it may be a full 5 minutes. It takes about 20 minutes of seizure for a baby to stop breathing. So that's quite a long time. So mark the time if you can, and that can be really helpful for the doctors as well. If your baby's umbilical cord seems to be getting infected, that is an urgency. That's something you want to get into your doctor as soon as possible. But if you can't get in within a few days, you can always go to the emergency room for that too. And what that looks like is the skin around the umbilical cord will be red and swollen and warm. It might be tender, like if you touch it, baby might cry. Also, if there's any green discharge that's foul smelling, that is infection, and that needs to be dealt with right away. With an umbilical cord infection, it's a skin infection all around there, and the redness will spread out in a circular fashion within days, sometimes even within several hours. It can progress pretty quickly and then can start to get into their bloodstream, and that is very dangerous. So you want to get that treated right away. And that's why we tell you to keep the umbilical cord dry and out of the diaper until it falls off, because if it gets wet, it soaks up water just like an old dried sponge, and then it grows that bacteria and it gets really gross like a sponge does. So yeah, any umbilical cord infection, you want to go in right away. And then the last thing is an umbilical granuloma. That's just an urgency. That's sometime in the next week or two you can get it dealt with. When the umbilical cord first falls off, it's normal to have it look kind of pink and raw, and sometimes to have a little bit of blood or some yellowish goo there. So once the cord falls off, even if there's a little blood, just wipe it with a wet washcloth. Keep in mind, the umbilical cord doesn't have a lot of nerves behind it. And so a baby won't actually feel it when it falls off. It doesn't hurt them. And when you wash it off, that also doesn't hurt them. But the skin around it does have nerves. Washing it with a cold washcloth can sometimes be a little surprising to baby and can make them cry, but you're not hurting them by doing it. So once the cord falls off, just clean the area with a wet washcloth, or you could use a cotton ball or rubbing alcohol with it, and the bleeding should stop right away. If you notice that there is still bleeding, like there's blood pooling up or dripping down baby's side, that is abnormal. So you want to hold some pressure on that for about 5 minutes. And if it's still bleeding, you should go into the emergency room or your doctor's office to get that cauterized. And then if there's that pink, shiny skin that stays there even after the belly button has fallen off and it's more than a day or two, and it's still pink and shiny, that's an umbilical granuloma. So those are super easy to treat. We cauterize with a chemical called silver nitrate, and it kind of looks like a long matchstick. We dip it in water, and then the silver nitrate we just apply on there, and it causes a chemical cauterization of the granuloma and makes it heal up and turn into regular skin. It does not hurt in babies because, again, there's no nerves on the umbilical stump itself. So it's totally painless. It does turn kind of black, sometimes gray. Sometimes there's even like whitish, silverish colored residue that's left behind, and it can stain your baby's clothes. So if you do notice that, you can just clean it off. Yeah, it's not dangerous or anything. It just looks kind of weird as it's healing, and it should heal over the next several days. So I hope this helps. These are all the major red flags to look out for in babies that I've seen, and things that come up pretty commonly within the first 6 to 12 months of life. So if you notice any of these, call your doctor. Remember, it's always okay to reach out if you're worried. And I hope this helps. I hope also this might ideally save you a trip to the ER if your baby is not this sick. I wish you all of the best, and I look forward to talking to you guys next week. And just real quick, if you could leave me an iTunes review, that would be hugely helpful. The iTunes reviews really do make a difference, and they help other parents be able to find this podcast. And if you know anyone else that this could help, please just pass the podcast along to them. I would love to help more parents out there. Thank you for tuning in. Make sure you subscribe, because next episode is going to be all about vaccines. Thank you for listening to the Baby Manual podcast. Please hit that subscribe button below so you don't miss the new episodes when they come out. I would also love it if you could leave me a review. If you'd like to buy a copy of the Baby Manual, it's on Amazon and Kindle. I'm the author, Dr. Carole Keim, and that's spelled Keim. You can also follow me on YouTube, TikTok, Instagram, or Facebook to get some quick baby tips that will make you feel like an expert. Thanks for listening.